If you could describe the residency program in one word, what would that word be?
I think if I could describe family medicine and our program in one word, it would be relationships.
I would say it's caring.
Outstanding.
Resilience.
Compassion.
This is going to sound really cheesy, but family.
Because you really grew to be family in that residency.
We're in family medicine. Why wouldn't it be?
In a word, it's pretty perfect.
Summa Health's Family Medicine Residency has created a legacy of caring for patients and community. And tonight, we celebrate the 50th anniversary of the Family Medicine Residency.
As chairman, looking back now to reflect over our 50-year history, it's been great to see how the reputation of the program has grown nationally. The initial spark that was lit by Ed Shahady and Dave Hoff and Jay Williamson and Dick Hines has been carried on and kindled by Bill Smucker and Sharon Van Nostran and Melanie Bortel. And I think that as we look at training family physicians for the next 50 years, that future is in very good hands.
I think one thing that family physicians do is love their patients. So how do you teach love? How do you teach respect? How do you teach understanding? We're taught in medical school, and I taught that myself, is how do you listen to the heart? I can't listen to the heart till I find out what makes that heart beat. How to be kind to patients. That's more curative than any pill or any surgical procedure.
When I think of residents who graduated from the program, the things that I tried to impact them and to help teach them was compassion. I have a deep spiritual life, and many of the residents that came through, we were able to even share spiritual values.
The thing I'm the most proud of during my time as residency director was the merger of the two hospitals' family medicine programs, St. Thomas and Akron City. That merger led to greater resident numbers and education, and also led to more resources provided for the program. The biggest lesson I wanted to impart on the residents that I was training was become a lifetime learner.
I was appointed as the interim residency program director starting in January 1995, and I was named as the permanent program director from then on. I never understood that whole process because that search committee had a whole month to see who I was and how I was, and they selected me anyway. I think probably the thing that I am most proud of is watching residents leaving the residency, full-fledged family physicians, oftentimes teaching me and the rest of the faculty on the way out the door.
I was the head of the inaugural Osteopathic program at the Akron City Family Medicine Residency. Probably the most important thing that we wanted for the osteopathic residency is to include the holistic approach when you're caring for patients. And we would take residents out to homeless outreach, or we would take them out and send them for volunteering, going to different clinics and that sort of thing, to stretch yourself and see the needs of your community and try and meet those as best you can.
When I think of my predecessors, I think of Ed Shahady, who built this program from nothing and became a national innovator in family medicine education. I think of Dave Hoff, who was calm, cool, collected, and did all he could to advance our residency. When I think of Jay Williamson, I think of another guy who just calmly moved things forward and helped us be the best that we could be. When I think of Dick Hines, I think of his priestly manner and that he always had his door open, and he helped set this environment up that I walked into and inherited. My goal for these residents is that they know how to stay healthy and take care of their wellness, and they become leaders in their practice to move change and to improve quality.
Most of my time has been working with Dr. Smucker as the program director, and I've been really fortunate to be able to work alongside him. I think the thing that I would like my colleagues to hear is just how amazing some of the stories that I hear about what our graduates are doing across the country, across the world, and it's such an honor to have been able to train with them and be a part of the program.
I was a resident here at the Summa Health Family Medicine Residency from 2001 to 2004. You know, when you graduate from medical school and you're so excited and you have this diploma and you think that's the moment, but then you quickly realize you don't know anything. And you are thrown into this residency situation, and the transformation that happens during those 3 years here at Summa for me, I'm so grateful for, because it started me along this journey that's really allowed me to realize, it sounds corny, but all of my dreams, truly.
Of course, it goes without saying, we work really hard, but we play really hard too.
The shirt that I wore, I pulled out of it's probably all wrinkled, but it says we are family. And then on the back side, it says practice. This was our uniform from one of the baseball games against internal medicine. And I think we won 7 or 8 years in a row. And it was a great time to get people together and just have relaxation as well as competition.
Which carried over between people. As we were rounding in the hospital, we'd let each other know who won the last time.
We went to each other's homes and we played cards together and we went out together. So we were a very close group.
I can remember our first and only residency hiking trip where we took a group of people out into the woods and hiked through CVNP, and it was very slippery, and one of our residents fell, split her knee open. We all helped her back. It was like a big party. It was a suture party. We were all laughing, had so much fun together. Amy was fine. Her knee was fine. Becky sewed her up. Everything was good. It was just a blast.
One of the things that I'll never forget at our graduation, Dr. Smucker is a huge guitar player, and so our class had asked him to sing us a song, and so he was able to get the rest of the faculty in on this song that was called Don't Do Stupid Stuff, and he was like, and don't do stupid stuff. Like, it was so funny. You know, he has like the verses and then the choruses, and don't do stupid stuff. It was so funny.
I think if you were to draw up your ideal family medicine residency program with the patients and the clinic and the staff and the support and the people and the work ethic, but the fun, I can't imagine a better soup. Actually, we used to call it that. And we are just going to keep that stew simmering.
This 50 years that we've been able to celebrate could not have been done without Summa, without Summa's support, without Summa's leadership, without Summa's commitment to primary care.
All of you contributed to the great growth and reputation. In fact, it's worldwide in its reputation. So many thanks to all of you, and congratulations.
I want to congratulate all the former directors and all the former residents who've graduated from this program. They all inspired me, and they laid the groundwork for where we're going in the future.
To all my colleagues of the Family Medicine Residency Program, those who came before me, those who I learned from, and those who I had a hand in teaching, I want to thank you for spending the time with us. I look forward to the time when we can all be together again in person. Stay well and stay family medicine strong.
Congratulations, Summa Health Family Medicine.